Hello everybody, how are you everybody? I hope that everybody is doing well, and Ohio to all my Japanese friends. This talk is a short talk, not only for doctors, I can say it's for the public also, and this is part of my clinical practice notes for improving and raising the health awareness of the community regarding diseases affecting different organs in the human body. As a part of my job as a healthcare provider and being a medical expert and a consultant physician. What I want to say in this mini lecture is that is a continuation also of what I was talking about regarding the hepatic lesions and the clinical presentation of liver disease. I want to confirm on the point that the liver is the largest solid organ in the body, and it is the largest number two large organ in the body after the skin. But among the solid organs, it is the largest organ in the body. And the liver is considered the kitchen of the body, the kitchen of the human body, أو المطبخ بتاع الجسم هو الكبد أو liver. And many of the biochemical reactions which affect the human body, they are processed either in the liver primarily, or the liver plays an important role as a secondary moderator in such biochemical reactions which guide the physiology of the human body. And any disturbance in this physiology or in this biochemistry of the liver by any disease process, whether inflammatory, infectious, neoplastic, autoimmune, vascular, metabolic, any of the different pathologies or the pathological processes which affect the liver and disturb its anatomy and physiology, will produce pathological features of liver disease. And the possible presentation, we all know that the main functions of the liver are production, number two, storage, number three, metabolism and excretion. So regarding the production, it is an important organ producing many important substances in the body. It produces the bile, which helps in digestion and of food, and this biliary secretion helps reach the intestine and helps in the digestion of fats and proteins and other substances. So production of bile in the liver, number one. Number two, production of proteins, which are part of the plasma, what we call the plasma proteins, including albumin and globulins. Also production of cholesterol, which is an important fat forming and forming the basis of many important substances, and forming the basis, especially the basis of sex hormones, the basic nucleus of sex hormones, which are produced by the primary sexual organs, the ovaries or the testes, or by the adrenals, is cholesterol. So cholesterol is produced in the liver, and also the proteins which carry the fats in the blood and to the receptors, they are formed in the liver. So the liver is producer of many important substances for the blood, for the digestion, for the metabolism. So it is important, has important synthetic, what we call synthetic functions. This is synthesis. And number two, also it helps in the storage, like for example storage of fat, storage of glycogen, storage of trace elements like iron, like copper, like zinc, like vitamins. So it is an important storage organ for substrates and nutrient substrates and major nutrients, including carbohydrates, proteins, and fats or lipids, and trace elements and vitamins. So it's an important storage organ. Number three, it is an important organ for metabolism, especially the metabolism of drugs. So the drugs, when you take drugs, they are processed in the liver. When you take foods, they are processed in the liver. So the type of food you are taking affect the liver. So be careful from the food which you are eating or take, it affects the liver. Be careful from the drugs which you are taking for different purposes, even the paracetamol, because it affects your liver. So here the liver is an important organ for metabolism of many drugs. Actually, the liver and the kidney are the major organs which manipulate any drugs or foreign substances which enter the body, and they are responsible for their metabolism and their excretion. So the liver is very important as the kidney in the metabolism and the excretion of many drugs, because it contains many enzyme systems which manipulate the drugs, and part of what we call the pharmacokinetics, they take place, part of the pharmacokinetics, that what is the body do to the drug, and the drug during its movement in the body till it reaches to its receptors or the organs for their action, they take place in the liver. So be careful from drugs, they affect the liver. Same as they affect the kidneys, same as they affect the bone marrow. So the metabolism and the excretion is another function, important function of the liver. As I mentioned, excretion after metabolism, many of the drugs and many of foreign substances, they are excreted through the liver after their metabolism. So these are in short the main functions of the liver: synthetic functions, storage functions, and metabolism or metabolic and excretory functions, in addition to other functions of the liver, like the role of the liver as an endocrine organ and in the manipulation of hormones, as a producer of hormones, as a modifier of hormones, as a coordinator or a processor for many hormonal or many hormones during their action in the body. They have to pass through the liver and they have to be processed in the liver. So this is what we call the liver as an endocrine organ. So it plays an important, very important role in the metabolism. That's why when the liver is affected by disease, it will have metabolic complications, what we call the metabolic sequelae of liver disease. It will affect the metabolism, it will affect the hormones, it will affect the enzymes, it will affect the proteins in the body, it will affect the carbohydrate metabolism in the body, it will affect the protein metabolism, affect the fatty metabolism or the lipid metabolism. So it will, some of the substances which are normally metabolized by the liver will rise up in cases the liver is damaged and being unable to metabolize such hormones, and when the levels of such substances rise, they will produce dangerous or bad effects on other organs in the body, and this is exemplified, for example, by the metabolic encephalopathy due to chronic liver disease, or in patients even with acute liver failure. We have what we call metabolic encephalopathy due to abnormalities in the liver and inability of the liver to cope with the its metabolic functions. So the metabolism is disturbed and will produce disturbance in other organs. One of them is the bad effects on the brain due to rise of some metabolites, toxic metabolites, which affect the brain due to the derangement or destruction or damage to the liver, and consequently the metabolic derangements which happen due to the disturbance of the metabolic functions of the liver. Also, the liver as a storage organ will be affected. The liver as a synthetic organ will be affected. There will be hypoalbuminemia. There will be a deficiency in vitamins, water-soluble vitamins, fat-soluble vitamins, and there will be problems in trace elements and in metals, because they are mainly sensitized and stored in the liver. So these are all very